can we start?
Yes.
Okay. So good afternoon, everyone. So I am presenting a case of spleen Qi deficiency affecting the immune system. Okay. So this is a case of a 38-year-old female. She's a family counselor with a chief complaint of pain on the right buttocks and the right side of her upper back. So for the traditional questions, of course, she has those pain on those areas and sleep. She has difficulty going to sleep. She describes her sleep as a short sleep and she wakes up easily, but her sleep is not dream filled and she doesn't have any palpitations. Okay, so temperature, she actually feels she easily feels cold. um Her diet is actually good. She eats vegetables and she doesn't eat pork. um Lifestyle, she's in front of the computer several hours a day. Okay, actually almost the whole day she's in front of the computer because of her work. um Menses, okay, her menses are regular, heavy for the first 2 days with minimal clots, and menses duration is about 3 to 5 days. She also complains of some premenstrual symptoms like breast tenderness and headaches. When I ask her about her bowel movement, she has daily bowel movement, but her bowels are not her stool is not formed. Okay, so it's somewhat loose. It's not watery, but it's not formed, and bladder is urine output is essentially normal. Medications being taken are the pain medications for the pain that she is feeling. Okay. This patient has been living in the USA in Seattle for uh how many years? For several years now. Probably around 15 years. Where let's give a little background now. In Seattle, the weather is they describe Seattle as a place where it's always gloomy because it rains 8 months a year. Sorry, 8 months. Around 8 months a year, you have rain in Seattle, so it's kind of damp. Okay, so upon seeing her, she also complained of painful swallowing. So when I did a physical examination of her throat, it was congested. Okay, I'll show you a picture of the tongue, but later. But what was very prominent about the tongue is the crack on the spleen and stomach region. It's there's a little enlargement um with some tinge of with a purplish tinge on the sides, and her tongue has plenty of heat spots on the lung and the heart areas. I will show you a picture of the tongue later. Okay, and pulse is deep, and it's deep, it's strong, but it's not forceful. Other observations, her limbs are cold to touch, and then she has those dark circles around her, especially the lower portion of her eyes. They are really dark. Okay, now medical history. She brought her medical records with her. Okay, so she has atopic dermatitis. Um, she was she has been having this sacroiliac joint pain for years now. She has post-COVID chronic cough, chronic rhinitis, and she also has vitamin D deficiency. So the vitamin D deficiency is evident in the laboratory results that she showed me. Now, in her recent history, she had urinary tract infection last December 2023. And then before that, in November 2023, she also had acute tonsillopharyngitis, for which she was given antibiotics. Okay, so on both occasions, she was given antibiotics, but she complains of having diarrhea and vaginal candidiasis, usually on the fourth or the fifth day of taking antibiotics. So she told me that every time she takes antibiotics, this is what happens to her. Okay. Laboratory findings. Okay, so she had her the results of her allergen panel tests, and it showed this was in only in June 2023, and it showed abnormal allergen egg white IgE, allergen peanut IgE, allergen wheat IgE, and allergen cow's milk IgE. So she has a lot of allergies, really. Okay, and also LDL is high and HDL is low. Vitamin D is also low. Okay, so why what's the background for saying that the condition of the patient led to this deficiency of her immune system? Okay, so the material basis of TCM immunology are the Zangfus, specifically the lungs, the spleen, and the kidneys. Okay, so if and when any of these organs are affected, then the immune system of the patient will also be affected, just like in our patient. Okay, so um, to discuss the pathophysiology, the since the patient lives in a damp environment, the exterior dampness can invade the spleen. Um, so the patient initially, I'm sure the patient initially had a spleen Qi deficiency, and then it developed to become spleen Yang deficiency and lung Qi deficiency. Now the patient also has liver Qi stagnation. So uh, based on 8 patterns diagnosis, the patient is deficient, cold, and internal. And Zangfu diagnosis is spleen Yang deficiency, lung Qi deficiency, and liver Qi stagnation. So treatment principles will be tonifying the spleen Qi and warming the spleen Yang, expelling dampness, smooth the liver, and move the Qi. And we also have to calm the Shen. Okay, so this is her tongue. If you look closely, you will see the very deep crack in the middle. Okay, and then you will also see the um, prominent heat spots. Okay, in the lung and on the lung and the heart areas. Okay, and it is a little enlarged. Okay, so for my points, okay, I tonified the Qi with the use of stomach 36, spleen 6, and you also have your CV12, and for dampness, spleen 9 and CV9. And then since she has this chronic cough, I also tonified her lung Qi using lung 9 and lung 7. And then that is complemented by Li4. And then to calm the mind and to calm the Shen, I used Du20, Intang, and PC6. Okay, I also used to smooth and to move the Qi, I used Liver 3 and GB34. And the Sanjiao here, Sanjiao 5 is to help in the overall movement of Qi in all three burners. And I also use this Bakshu points, okay, for the lungs, for the heart, for the liver, the spleen, and the kidneys. And then I used Ventosa on those specific parts of the body where she complained of pain. Now, aside from the acupuncture points, I also prescribed antibiotics to her. But um, I was aware that she 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 has problems whenever she takes antibiotics. So I chose a short course antibiotic to give her. So I gave her azithromycin 500 milligrams to be taken 3 to 5 days. Okay? But for the tonsillopharyngitis. But I also advised her to modify her diet. So I told her to eat some rich foods, like for example you have your sweet potato or your seaweeds, your what else, dates, squash. And then I also told her to expose herself under the sun. Okay, so according to some journals, the um patients should expose themselves for about 10 minutes a day between 10 a.m. to around 2 p.m. That I think is what she really needs. And then I advised her also not to be exposed too much to cold. Now when she came back the week after, she she described her pain to have a very big improvement. So she wasn't complaining too much of the pain anymore on the upper back and the and the right buttocks. Okay, the tonsillopharyngitis was resolved, and the good news is she didn't experience any diarrhea. She didn't have any vaginal candidias. Sleep became better. Okay. The dark circles underneath the eyes are still there, but they became relatively lighter. Okay. Much better than when I first saw her. Okay. So I repeated my points, but uh I added Asher points on the right upper back and the buttocks. Okay, because although there's an improvement, there's still some pain, and then I did Ventosa also, and then on the third visit, okay, the upper back and sacroiliac joint pain is almost relieved, almost resolved. Okay, but still, her stool is not formed, not yet formed. But I really do not expect her um, deficiency or spleen yang deficiency to disappear right away. Okay, and sleep is inconsistent. It she, Sleep became better, okay, but still not as restful. And then okay. I saw her this morning, and she said that she will be going back to the States on Monday. So I told her to um keep herself warm because of the damp environment. So I told her to as much as possible to have acupuncture in Seattle because she already had acupuncture before. Okay. And then in a day or two, she'll be having her she's expecting to have her menses. And the good news is she's not feeling the PMS that she used to feel before. Okay, so she doesn't have a headache, and her aversion to cold is not that bad anymore. Okay, so it has also improved. Okay, so what advice can you give us as far as this patient is concerned? Because I'm sure we will be encountering um, other patients similar to this. Thank you.
Thank you, Dr. Anner. And I think this case is very strong effect about acupuncture, and so it's very surprised to me because the patient head back pain is almost released. It's very good. And does anyone has question or some suggestion about this case? Dr. Wu?
Hello, long time no see. Dear.
Hello.
And I really appreciate your great work about this patient. And this patient, the chief complaint is the pain in the right buttocks and right upper back, right? And I also think the same as you. Just for this kind of pain problem, we think that the chi stagnation and blood stasis is a very important thing. Just for the blood stasis, you see her has minimal clots of her menstrual cycle, and her tongue is purplish on the sides, and she has plenty of. I think the tip of her tongue is a little bit dark. It's a little bit purple, so I think that is also a symptom and sign of the blood stasis. So for this kind of a little bit blood stasis problem, we think the liver meridian number 3, liver meridian and pericardial meridian is the best meridian to treat the blood stasis, because liver meridian and pericardial meridian is it can tonify the flow of the blood. It can let the blood to move quickly, so it can treat this kind of blood stasis problem. And I also agree with you that this patient has a chi stagnation problem. So for the chi stagnation problem, we have a famous set of the acupuncture point for the liver 4, the large intestine 4, the He Gu, and the liver 3, the Tai Chong. These four acupoint, just we think it's a very famous 4 acupuncture point, because the location of the He Gu, the large intestine 4. Can you see you can see my hand? Can you see my hand? Okay. Can you see my hand?
Yes.
So I think the location of the acupuncture point, because we always do things like this. Yeah, we also always do things like this. So this acupuncture point can control the close and the open of our body, and also the same effect of the liver 3. So large intestine 4 and the liver 3, but these 4 acupuncture point can control the chi to open or to close. So it's a very good acupuncture point to treat the chi stagnation. And because she also have the breast tenderness, right, for the PMS. So I also think the chi stagnation is one of the most important syndrome classification of this patient. And she also have difficult to going to sleep, right? So difficult to fall asleep is related to the liver chi stagnation. I also agree with you, the liver chi stagnation problem. And I think she has a teeth mark, a little bit. So I think yes, also chi deficiency. And the crack of the tongue is very prominent. So I think there is a little bit indeficiency. But maybe we can discuss with other doctor the crack of the tongue, the 裂舌头的裂，我觉得有点阴虚。So we think that is maybe a little bit of indeficiency, but I am a little bit wondering why you think her has some dampness of her body. I know she live in the Seattle, right? There is a place full of water, full of raining. But about the symptom and sign, why you think she has a dampness problem?
Oh, simply because of her exposure to her chronic exposure to a damp environment.
Ah, okay.
Because she's been living in Seattle for 15 years, I think.
15 years.
Wait, 30, yes, around 15 years.
Okay. So, did she have some symptom or sign about the easy to feel tired or feel the body is very heavy to move, or
Yes,
yeah,
she has tiredness.
yeah,
Yes.
tiredness, or
Yes.
for me maybe I will check the tone and the pulse together, because if the has the water dampness, the tone might be a little bit, the coat, the tone fur will be a little bit thickness, but not always.
Okay, yeah.
Sometimes it will be a little bit thickness for the tone fur, and the pulse might be a little bit. The pulse will be, the age of the pulse will be not so clear. We call the a little bit slippery the pulse. So I think
Slippery.
for this patient, I will not so sure about the dampness problem, because I think that in my environment is very important for the TCM. We think that the environment is related to our body, related to our syndrome classification, but not always the same. For example, this day Taiwan is very cold. We have about under than 10 degree, but this cold, the wind and the cold for the environment, some of the patient will also feel very cold. The syndrome classification will be cold and wind, but some of the patient receiving this kind of wind and this kind of cold will turn into a heat inside, internal heat. So it's a very interesting thing that the environment, the effect of the environment is overwhelming, but the reaction of our body is different. So sometimes if the people live in the city full of raining, might not might not have the dampness syndrome. Maybe yes, maybe not. So I think we have to make sure that she have the dampness problem. And then I think she also have the acute tonsilopharyngitis.
Yes.
Right? Yeah. So so we have a specific symptom or disease called globus pharyngeus. You know that? 没和气. It means that also like have a sputness to stuck in the throat, but difficult to swollen inside and difficult to cough off. So so I think it's a little bit like this kind of the syndrome, and the reason of the globus pharyngeus is the chi stagnation. So I think this kind of the chi will not flow so fluently, so the chi will stuck in her tongue. So maybe I think the acute tonsilopharyngitis will related to the chi stagnation.
Okay.
I think the just for us to treat this problem with lower back pain and butoc pain, we will have two sides. The one important is to treat the syndrome classification. We can treat just we said that to treat chi stagnation, to treat blood stasis, and we also can treat the location itself. Just for treating the location of the lower back pain or treat the pain of the butoc problem, we can use like the urinary bladder meridian, because the urinary bladder meridian just goes through the lower back and the butoc. And we also can use the this the cortical homunculus. You know this? Can you see my head? The cortical homunculus.
Okay.
And we also can, because the cortical, we also can use the brain cortical, which control the lower back and the buttock to treat this kind of problem. And we also can use the location of our hands, the west hand point here, here and here can treat the lower back pain problem. Because here is the bone, right? Till the end, when the bone cross to a line here has a acupuncture point called 腰痛点 the lower back pain point. Here is one, here is another. So I think this kind of the acupuncture point can treat the location itself, and we also can treat the syndrome classification. And I think this will be a good acupuncture. A good acupuncture way to treat the syndrome classification and also to treat the location together. And really thank you for your presentation. We also learn a lot from your presentation about this case. And thank you for sharing us such a wonderful case. Thank you.
You're welcome. You're welcome.
Thank you, Doctor. Very detailed treatment for this low back pain. And I have two questions about the case. The first is the first one visiting doctor, you told the patient to eat something to improve his qi. What food can improve the qi? I want to know. And the second is, do you use the manipulation for the patient to increase his qi flow? Related to my question.
I'm sorry, I didn't get the first question. The
But-
foods, the food that will enrich qi.
Yeah. What food?
Yeah, her because I think her she's having this repeated infections because I think her qi is very deficient. That's why, specifically her lung qi and her spleen qi. That's why I told her to eat foods that will enrich her qi.
I know. And the second one is do you use the motivation to improve the qi? Motivation.
Motivation.
The motivation.
Motivation.
艾灸.
Moxibustion, yes. Because since the patient feels cold, specifically the limbs of the patients are cold. Yeah, moxibustion.
Okay.
But then I minimize the use of moxibustion for her because of her allergies.
Okay. Thank you. And does anyone have question? No, and we can.
Dr. Chen,
Okay.
Hi, Dr. Chito. Nice to meet you.
Dr. Lin, how are you?
Hey.
Dr. Wu, how are you?
Hello.
I usually do double tien, concentrating on lumbosacral and the lower back. Taught to me by Dr. Ling in scalp acupuncture. Double tien.
Okay.
And
On the head, yeah.
And I I use Linggo Dabay Xiongbai. I don't know maybe Dr. Wu can comment on this. I use that a lot for back pain. I don't know how what you think about it. Also, the double TN for the homunculus of the back.
Okay, hello, Dr. Shito. And we think that the Tian acupuncture is created by Dr. Lin, and it means the scope. Can you see my head here? And we do the scope acupuncture and here, here, and the middle. So these 5 needles create a shape of Tian, a character of the TCM words. So it's 1, 2, 3, 4. The middle is 5. But it's very simple since it's just the holography, because our head, the back of our head, is just like a person, and from the head to the neck to the chest to the waist and to the buttocks. So here is also related to here is the head, the neck, the chest, the waist, and the buttocks. It's the same. So it just, we can treat all the back problem on the scope. So I think it's very efficient to see. Every lower back pain problem, we will use the Tian to treat this kind of problem. And I think the acupoint in here is also very important in the hand. So like you say, the Ling Gu and Da Bai. Most of the time, Ling Gu is related to the West problem. So we just say there is another acupuncture point we call the lower back pain point. It's in here and it's in here. So you can see the location is very close. It's all around this line. So also this another acupoint. Here is the Wan Gu, the small intestine.
3.
Okay, small intestine 3.
So 5 and 5.
Small intestine 5. So here and here and here and here all can treat the lower back pain problem. And it's also the holography, the same theory, just related to our whole body, but it's a little bit different. Here is the small intestine is the we say the 太阳 meridian. The small intestine is related to the urinary bladder meridian. The relation is more close to the urinary bladder meridian. So this here can treat all the urinary bladder meridian problem. And here is just like the upper back, and here is the head. Here is the upper back. So from this point, the small intestine number 5 can treat the lower back problem. Yes, and here is the large intestine meridian. So large intestine meridian is full of qi and full of blood. It's full of energy. So it's very strong. So we always use this to treat the patient with stroke, to increase the power of the muscle. So it's also a very efficient way. And we just say about the He Gu is very strong because we always do things like this. We always do lots of the motion like this. So He Gu is a very important acupuncture point. And Ling Gu is more close to the bone. So when the symptom is related to the bone problem, just like the lower back pain or the buttocks pain, the bone is a major problem. We can use the Ling Gu rather than He Gu. Yes, and here is another. We just introduced another acupuncture point to treat the lower back pain. Here is lower back pain point 1, lower back pain point 2, because the hand here is just it's just like a spine here. And here is the head and the neck and the shoulder and the chest and the waist and the buttocks. So these two acupuncture points also can treat the lower back pain problem. So I think all of this 1, 2, 3, 4. This 4 point is very efficient to the lower back problem, but still a little bit different of each point. And we can see which kind of point of the patient has which kind of point, and we just choose the best acupuncture point for him or for her. Yes. Okay. Thank you.
Thank you.
Thank
Dr.
you.
Ulu. Thank you. I also employ Yamamoto, YNSA. Sometimes I do Linggo Dabay Xiongbai and Double Tien and Yamamoto all at the same time.
Yeah. Because some of the severe patient we will have more acupuncture needle to treat. Yes.
Thank you for confirming my. Sometimes I'm not sure that I'm doing the right thing, but thank you for your clarification. That was very helpful, Dr. Wu.
Thank you so much. Thank you.
Okay, thank you.
We will be visiting Hualien again soon.
Wow.
To
Come to Hualien.
yeah.
Welcome to Hualien.
Probably in the next February we will be there.
Next February. Wow.
This February,
Yeah.
you know, but we will email you first.
Okay. You
Thank
can
you.
send us the Facebook, the messenger.
Yes, Dr. Wu.
Yeah.
Apologies to Dr. Eileen, I butted in.
Oh, it's all right. Perfectly all right.
Thank
Okay.
you.
Thank you. Thank you, Doc Chito.
Thank you. And does anyone has question? I think Dr. Wu to speak very detailedly about this case. And if anyone has question, we close the conference. Okay, thank you everyone. Bye bye.
Great.
Thank you so much.
Bye.
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 Thank you,
Have a nice
Dr.
day.
Paulo Dongmi. Thank you for your
Thank you.
Yes, thank you. See you. Thank you, Dr. Professor Lai.
Hey.
Thank you, Professor
Bye-bye.
Lai.
Bye.
See you, Dr. Chito. See you in Hualien soon.
Welcome.
Hello, Megat, Dr. Megat. Hello.
Hello. See you soon.
Hello.
Bye-bye.
Bye.